All right, good morning. This is the Anchorage Emergency Operations Center operational update for August 12th. Okay, situation overview. Today is day 527. Locally, our cases are up 976 with 4 deaths and 24 hospitalizations. Statewide cases are 2,138, 16 deaths, and 100 hospitalizations. 213 resource requests. We've filled or satisfied 1,798. Filled 2 since last report, and currently we're working 7. For the Sullivan Arena, we are at 339, up 20. For non-congregate, 378, down 11. All shelters totaled 717, up 9. For testing and vaccinations, Visit Healthcare has collected 6,189 in the last week, and total pods are up 983 to 88,349. Weather, go ahead.
Good morning, everyone. This is Michael Cutts with the National Weather Service office out at Sand Lake. I'm basically looking at a series of impulses bringing us some additional rain through the next couple of days. Periods of rain lasting today, tapering to showers tonight, and then becoming scattered showers tomorrow and tomorrow night. Weekend's looking like the only good days, with Sunday being the sunniest day of them all, and it'll be breezy conditions along Turnagain Arm and across higher elevations for today. That concludes my briefing. Any questions?
Thank you, Weather. Testing, vaccinations, go ahead.
Good morning, everyone. This is Pat Ryder, Emerging Infectious Diseases Assistant Program Manager. Today with testing, an announcement. The Alaska Airlines Center parking lot is now open for testing. Schedule will be 7 days a week from 8 in the morning to 4 p.m. Visit Healthcare reported the following over the last 7 days, to include a 12% increase in sample collections from community and priority populations. Broken down, this represents a 6% increase in sample collections at the community testing locations and a 46% increase in sample collections of priority populations. Samples have been averaging 26 hours for notification of results over the last week. Cases in the community and priority populations are continuing to rise. Across a 7-day average, we're averaging 96 cases per day. Our 7-day average positivity rate is 8%. As of August 10th, our estimated daily growth rate is 3.68%, and cases are predicted to double in just under 19 days. Our 14-day average reproductive rate is 1.169. A reminder that a reproductive rate above 1 indicates that the virus is continuing to spread. And our 14-day average case rate is 38.3 for every 100,000 residents. Our current alert level is high. This indicates that there is widespread community transmission with many undetected cases. Next slide, please. With vaccines, Visit Healthcare clinics had an increase in the average daily vaccinations of 11.5% from the previous week. We have a few pop-up vaccine clinics. The Fairview Rec Center will be hosting today from 11 a.m. to 4 p.m. Tomorrow, August 13th, from 2:30 to 6:30 p.m. And Saturday, August 14th, from 2 to 4 p.m. We have the Spenard Food Truck, which is hosting today from 11 a.m. to 2 p.m. The O'Malley Golf Course will be available tomorrow, August 13th, from 2 to 6 p.m. Also tomorrow, we have Peratrovich Park from 1 to 2 p.m. And Clark Middle School will be hosting Saturday, August 14th, from 10 a.m. to 2 p.m. Finally, just a reminder, our mobile vaccine clinics can come to you wherever you are, be it a church, business, or other organization. For more information or to schedule, please dial 907-531-5100. This concludes testing of vaccines. Barring any questions, end of report.
Thank you, Testings Vaccines. Contracts Logistics, go ahead.
Good morning. This is Wendy Reese, Contracts and Logistics Section Lead reporting. The testing contract is currently extended through August the 25th and is in purchasing for an additional extension through 10/31. Vaccination contract is extended through 10/31. We currently have 7 RRs ready for order. All personnel contracts are extended through September the 30th. End of report.
Thank you, Wendy. Finance, go ahead.
Good morning. This is Carrie Wiedeker filling in for AJ Malone. Currently, the EOC has encumbered $18,855,855. Our total spent to date is $71,188,060 for a total of $90,000,000. That's 90. $43,915. As always, please continue submitting any invoices and supporting documentation to eocinvoices@anchorageak.gov. The Office of Emergency Management does continue to seek cost recovery in the form of FEMA public assistance. End of report.
Thank you, ma'am. Safety, go ahead.
Good morning, everyone. This is Annalisa Roberts reporting out for safety. You probably have seen this picture a few times already in the past year since we've been fighting the good fight against COVID. But the one layer of protection that it's missing is the vaccination. So while we don't have anything that will protect a person 100% against COVID-19 and the Delta variant, the vaccine is the best protection we have against both of those. Getting vaccinated, along with wearing a mask indoors when appropriate, social distancing, and good hand hygiene, along with testing as needed, will help keep everyone safe and healthy and keep moving forward so that we can get out of this sooner rather than later and we can do the fun things we want to do with our friends and loved ones. End report.
Thank you, Safety. Public information.
Good morning, everyone. This is Public Information Officer Heather Orono. Just reminding you that if you would like to stay up to date with information about our COVID response, you can use the social media accounts listed at the top of the slide. The UAA Airlines Center has opened up for testing. Please help spread the word just so people know that that's available to them. We also wanted to invite everybody out to the Northway Mall this Saturday at 2 p.m. There's going to be a Sleeves Up for School carnival where there will be, among other things, backpacks and school supplies handed out, along with other information about the importance of testing. We'll have a vaccination clinic right there. So if you've been waiting for a good opportunity to get the whole family, and by that I mean everyone who's eligible for the vaccine vaccinated, we'll make that as easy for you as possible. So again, that's Northway Mall at 2 p.m. this Saturday. We're also working on completing translations for 8 of the flyers that about vaccinations, testing information into 6 different languages so that we are making the information as accessible as possible to everybody in Anchorage. And we'll be working on sharing and distributing those once they're available. And as always, continuing our research into getting the best information out to the public as possible and continuing that outreach to our community members. Barring any questions, end of report. Thank you.
Thank you, Public Information. Liaison.
Good morning. This is Durielle Welch, Acting Liaison Officer for the Anchorage Emergency Operations Center. Thanks to all of our partners who were able to join us today. Do we have any cooperators that would like to report out?
Hi, this is Lieutenant Cooley here from J-Bear on the line. I can give an update on our vaccination numbers.
Okay,
So
go ahead, Lieutenant.
all right, so currently the Air Force, we've given out, we have 71 personnel with their first dose of the vaccine. And then fully vaxxed, we have 3,724 with both or the single dose vaccines. And then for unvaxxed, we have 1,818. And that's all I have.
Thank you for that. Are there any other cooperators? Okay, then let's get started with our hospitals. Colleen, are you on for A&MC, please?
I am. Good morning. As of this morning, A&MC had 22 positive COVID inpatients. 3 of those are vented in the critical care unit. On the med-surg floor, 8 patients were on high-flow nasal cannula, and 1 PICU patient was vented. And A&MC is continuing to see some staffing challenges, but we're working with traveling companies to see if we can get those positions filled. End of report.
Thank you. Sean, are you on for regional?
Good morning. Yes, Alaska Regional Hospital currently has 25 COVID positive patients, 5 ICU patients, 4 on vents. We have limited capacity, so in question, we have a limited EOC open. We are closely observing what procedures we can and cannot postpone, and we have been intermittently using our ambulance bay as an alternative care site to manage our current volumes.
Thank you for that report, Sean. Nikki, are you on with Providence?
This is Michael. I'm reporting out this morning, Michael Kubler for Providence. We have 30 positive COVID patients in-house this morning, 4 in the ICU with 4 on some sort of ventilation. And we do not have an incident management team or operations center open at this time. We are working at maximizing our movement of patients as appropriate through the facility to make as many beds as possible open. We're still very tight with staffing and with beds. We are not currently triaging or postponing any elective procedures. We do not have an alternative care site open. We are trying to maximize the use of the staff that we have available. We're not really recalling people per se, but we are trying to call people in for available shifts on a voluntary basis. And we don't have any immediate needs. Thank you.
Thank you for that, Michael. Kara, are you on for Matt too? Okay, not hearing anyone from Matsu. If we do get numbers, we will make sure we get those updated on this slide. I appreciate everyone reporting out for the hospitals, and we will make sure the numbers are updated on the slides for the 673rd vaccinations as well, and then that will be available for everyone following the presentation. And that's it for Liaison.
Thank you, ma'am. As a reminder, our next operational update brief will be at 10 o'clock next Thursday, August 19th. Everybody, thank you for coming and have a great day.